many industries are adapting to the demands of health and safety during the COVID-19 pandemic. So how does this affect physical therapy appointments? Chuck Thigpen from ATI Physical Therapy has some guidance to make the most of your online physical therapy sessions and manage the pain from home. Good morning to you, Chuck.
Good morning, Tiffany.
Thank you for joining me. I think a lot of people will be hesitant to try physical therapy virtually, but let's talk about some of the benefits of doing virtual physical therapy during this pandemic time.
During this time of social distancing and altered work schedules, e-learning with kids at home, it's changed the way we have to interact with the world. And so at ATI, we feel that online therapy sessions allow us to extend the expertise of our therapists to meet patients where they are, delivering the right care at the right time in the right place.
I'm glad you're doing it. And I think a lot of people are going to say, oh, I didn't realize that I could be doing physical therapy right now. So who should be doing virtual physical therapy and who's eligible as well?
Most any patient that has musculoskeletal pain, right? Neck, back, shoulder, knee pain, those aches and pains that maybe we're picking up as we have extra time at home and it's getting a little warmer and we're outside. As we get those things, physical therapy is able to help most patients. About 70% of patients can come directly to physical therapy and don't need any other medical care. And so actually most people who have joint and muscle pain are actually really great candidates for online therapy sessions.
I think that's great to know for people because they're at home thinking, I just have to live with this pain right now. And knowing that you don't can be a big relief for many people. So let's talk a little bit about, using it. You said anybody with the pain, but do you have to be a current patient of physical therapy so that you understand the movements to be able to do virtual PT, or how does that work?
Actually a new patient, new onset pain, let's say maybe you're out last weekend and getting some yard work done, you got a little back pain, and instead of letting it linger for a while and potentially getting worse, you can actually, through an online therapy session, your therapist can diagnose your problem, really give you a good sense of what's going on and what's driving your back pain, and get you on the road to recovery. And then during that session, if the way you present or the other things you have going on, or you don't progress, then your therapist can maybe get you to come into the clinic or get you to the right medical provider to make sure you know whether it's okay to kind of manage this at home or you need to actually go out and seek care somewhere.
I like all of that. Let's kind of break it down. How is it different than doing virtual PT versus a session in person? Because we saw some videos and some technology that seems like it's a tad different.
Yeah, it really gives us the ability, while we can't touch you, we can give you lots of feedback. So there's really three important parts. The first is we're able to show you your exercises, remotely. So we're able to give you and see you exactly what movements we want you to do. And then we can record you and actually annotate or draw on the picture and show it back to you, which allows you then to understand how you're moving. So it probably enhances the way the therapist is able to provide feedback and how patients are able to see that. And we think that really gives an optimal experience to really allow patients to understand the right way to exercise and hopefully gives a little motivation to stick with their program.
That's great. So how does it work? Because with ATI, are you calling first and setting up an appointment? And what kind of internet service do you need to use? Or is it like a Face or a FaceTime or a Skype, or how does it work?
Yeah, ATI, we've been working on this a while, and the platform that we've gone with is actually a little different than just a FaceTime or Google Hangouts or Zoom. It's actually a therapy platform that allows us to do the features that I described before of recording and showing the exercises back. And really, it doesn't require an app. So what you can do, you can go to atipt.com. You can click on schedule a ATI Connect appointment. It'll connect you right with a therapist locally to you that can deliver your care and schedule the appointment. And all you need is just the ability to have a device. It could be your tablet, your phone, a laptop computer connected to good Wi-Fi that has audio and video, and away you go.
Wonderful. Thank you so much for joining us, Chuck. I love that information.